Well, hey, everybody. This is Byron Matthews here with Smoky Mountain Group. Want to welcome you to our video. We're going to cover the benefits at a glance and the summary of benefits for the Humana HMO Gold plan. So this information is if you've selected this plan or you're thinking about selecting this plan, we're going to run through a lot of information. So if you want to take notes, you can, but we're going to send you or give you, and maybe you've already gotten copies of all this. So as you go through this, if you have any questions, definitely just reach out to us and let us help you. Does that make sense? So I'm going to go to where I can share the screen here with you, and you should see me up in the corner, and then you can see the details of the plan. This is for 2023 Humana HMO Gold Plus. All right, so first of all, you're going to notice, and hopefully you can see my mouse on the screen here, but no premium, zero premium. That's the way it is this year. That's the way it's going to be for 2023. And we're excited about that. So that's going to be a great plan because no premium. Now, you do have to pay your Medicare Part B premium always to have a Medicare Advantage plan. Unless the state helps you with low-income assistance, you still have to pay Part B premiums, but no additional premium. Maximum out of pocket, $4,900 in network. What does that mean? Well, $4,900 is the most you have to pay. Some people get confused with the deductible, thinking they have to meet that first. No. If you go to the doctor and it's a specialist and it's a $35 copay, as you see right here, $35 copay, that counts towards your $4,900 maximum out of pocket. So you'd have to see a lot of doctors, a lot of hospitals, and really only, I think it's about 3 or 4% of people in America ever hit the maximum out of pocket with their Medicare Advantage plan. So a very small percentage of people who do that. So your primary care doctor, your family doctor is 0, your specialist is 35, and you do not have to go to your primary doctor to go see a specialist. You can go straight to your primary care, straight to any specialist that you want that's in the network. And around here in the area that you're watching this video, we have a lot of doctors. Nobody can say all doctors, but we have no problems with network. We've had this plan since 2018. So it's going to be easy for you to find a doctor or specialist, and we can help you with that. Preventative screenings, preventive care screenings. These would be like cancer screenings, PSA tests, mammograms, pap smears, those kinds of things. No cost for that. And you see it says in-network provider. And this cost sharing column, this is if you have Medicaid, which is low income assistance, Medicaid. So we're going to focus over here because I have a different plan. If you have Medicaid, you need a different plan. But when we say in-network, the network, again, you can't go out of network with an HMO, but that's never been a problem in the 5 years that we've had this plan. So been pretty good network around the area. Telehealth, if you go see the doctor on your phone, a lot of people do that. That really got started with the coronavirus. You can see the doctor on your phone, and you pay no copay for a family doctor, 35 for a specialist, 0 for urgent care, 0 copay for substance abuse. If you go in the hospital, it is a $395 copay for days 1 through 5. So if you stay longer than 5 days, you pay 0. That $395, which adds up to $1,975 max, that is all you would pay. The bill could be $500,000. That's what you would pay, because that's going to include the room and board, the doctor, the anesthesiologist, everything. All the costs that you would incur if you're admitted to the hospital are right there for 5 days. Now, of course, if you're there for just 1 day, it's $395. 2 days, well, 2 times 395, what is that? $790. Okay, do the math. So lab work is 0 if you use Quest Diagnostics or LabCorp, which are freestanding labs. If you use a lab test associated with your hospital, it's going to be 20. If you have an outpatient surgery at an ambulatory surgical center, that's a freestanding surgery, not part of a hospital, $345 copay. That would be like a cataract surgery. Physical therapy at a therapy facility, $10. X-rays at a hospital, $95. Continuing on here, diagnostic testing at the hospital, $85. And these would be outpatient, of course, because inpatient it's covered for that $395 a day. Inpatient psychiatric hospital, $395 a day for 4 days. Again, no copay if you stay longer than 4 days, up to 90 days. For a psychiatrist, $35 copay. Hospitalization, $85 copay. Outpatient hospital, that is, and partial hospital, $35 copay. Emergency service like urgent care, $35 copay. Ambulance, $300 copay per date of service. So if the day you go in an ambulance, it's $300. If they take you in a helicopter, it's $300. This is amazing. Emergency room, $110. That covers everything in the emergency room, $110. If you're admitted to the hospital within 24 hours, they waive that. Additional programs, HMO travel benefit. The Humana HMO network is nationwide. So wherever you travel in the United States, you're going to find an HMO doctor in the Humana network. You can go see that doctor. It doesn't have to stay in your home state. The dental, these two dental combined give you $2,000 a year of dental. Anything but cosmetic, root canals, x-rays, cleanings, exams, crowns, virtually everything. There's maybe a few exceptions like cosmetic, okay, but up to $2,000 a year. And you can see any dentist. If they're in network, it's going to pay for everything. If they're out of network, it's going to pay what's now called usual and customary charges, which is going to be a larger share than it's paid in the past. So there's a great improvement to the dental plan for 2023. Vision services, you can go to the eye doctor of your choice, of course, in the network, and they'll pay up to $100 on glasses or contacts. Routine hearing checkups, there are hearing aids that you can get, and we'll see those in the summary of benefits in a minute, what the costs of that are, but you can get some reduced price on hearing aids. Over-the-counter catalog. For many of you that have had this plan in the past, it was a little bit less for 22. In 23, it's going to be $50 benefit every 3 months. So every 3 months, you got $50 that you can order over-the-counter stuff. What is that? Vitamins, Advil, Tylenol, Band-Aids. They even have the little Fitbit that you wear around your wrist. You have $50 credit, and anything in the catalog up to $50, you don't pay for it. And if the total of your whatever you order through the mail order catalog is, say, $60, you'd only pay $10 because you have a $50 credit every 3 months, and that does not roll over. So you have to use it every 3 months. Transportation, zero copay for up to 24 one-way trips to the doctor, up to 150 miles. And you say, well, how do I get home? Well, that would be 12 round trips. Okay, zero copay. Silver sneakers. Everybody loves silver sneakers. That gives you the gym membership at over 15,000 gyms around the country. Then there's a special supplemental benefits for chronically ill. This would be people that have chronic obstructive pulmonary, COPD, diabetes, congestive heart failure, or even depression. If you're participating with care management services, you can get up to 2 meals a day for up to 12 weeks, and you can do that up to twice per year to help stabilize your diet, to give you a balanced diet. Those meals are delivered to your home for free. And the Well Done meal program is if you come out of the hospital or the rehab center, they're going to send you 10 meals for free. These are frozen meals delivered to your door. And most of the people that have had these told me they loved them, that they actually tasted good. So that's good. Prescription drug benefit. This plan does cover your Part D drugs. You can see your copays here for generics, name brands, non-preferred name brands, and specialty drugs. But here's where they want you to focus. See how this is red? If you do mail order, 90-day supply of all your generics are free. 90-day supply of name brands gives you about a $10 discount and a discount on tier 4. So you can do a 90-day supply through the mail, and it's called CenterWell. It used to be called Humana Pharmacy. Now it's called CenterWell Pharmacy. So you might see that lingo in the mailbox, coming in your mailbox. That's part of Humana, CenterWell. So then you can go to a store and you still have copays at the store, retail store. And again, you're going to have a copy of all of this. If you get extra help for people with the lower income, you can pay a smaller price. And if you want to know how to get extra help, I say call the Department of Social Services. They can help you with the application. They can tell you right off the bat on the phone if you qualify based on your income. I don't memorize those income levels because they change every year, and you can call DSS to find out if you can get the extra help and then reduce your price of drugs. And we scroll down here, and the last thing is stuff that I got to show you there. All right, so then here's a summary of benefits. And I'll scroll through this a little bit quickly because we covered most of those in the benefits at a glance. First of all, here's the counties. If you live in one of these counties, this is the plan for you. Potentially could be the plan for you. If you don't live in these counties, you need to not watch this video because this is not for you. But there's your counties that have this plan. And here's a checklist, understanding how all this works. Summary benefit, again, the counties are listed there. And I'm scrolling on down here to get to the benefits. To be eligible, you of course have to have A and B Medicare and live in a service area, which if you got this video from us, you're living in the right area. And that's why we recommended this particular video. You can call the company, any details about your location, but we've given you this because we believe you're in the right area. And then it goes through pretty much the same stuff in a little bit more detail. No premium. There is no deductible for Part D. Hey, that's a good thing. That's a change for 2023. No deductible on all tiers of drugs. All drugs, no deductible. And of course, there's no deductible on the plan itself. You have the $4,900 maximum out of pocket that we talked about. There's your hospital copay. There's your outpatient hospital service. I told you $345 at an ambulatory surgical center. It's $395 if you have an outpatient surgery in the hospital. Doctor visits are $0, specialists are $35. Again, this is just what we covered on the benefits at a glance, but I do like to show you this. You do not need a referral to receive covered services from plan providers. In other words, you don't have to go to your family doctor to get referred to a specialist. It says it on the bottom of the next 3 or 4 pages, so you don't have to worry about that. Sometimes you need prior authorization on different things, like maybe an MRI or something. If you ever have trouble with that, don't call Humana, call us. We can help you get that speeded through. Sometimes it gets delayed. Sometimes we found out that the prior authorization was given and it was sitting on the doctor's secretary's desk and they just didn't see it, but it was done. So call us and we can help you with that if that's ever a problem. Preventative care things like breast cancer screening, cardiovascular. I told you all those things were free. I mentioned that earlier. This is just a long list of them. Here's your emergency room, 110, urgent care, 35. Again, you don't have to go to your primary doctor to go see a specialist. It says it there again. Diagnostic tests, $35 to $75. Diagnostic radiology, 100 to 20. You say, what's the difference between 100 and 120? Let's just always err on the high side and say it's going to be 120 or it's going to be 75. And if it's lower, great. But worst case scenario, 120. Then you've got lab work, 0 to 35, diagnostic tests, 0 to 95, x-rays, radiation therapy, 35 copay or 20%. So Medicare covered hearing exam. Here's what the hearing aids are. $699 for each advanced level hearing aid, up to 1 per ear per year. Okay. $999 for a premium level hearing aid. One of my customers used this service. They came to her house. They checked out her hearing. They brought the hearing aids to her house when they came in. They helped her get fitted. She never left her house. She paid $2,000, $999 for each ear. And she told me there were $4,000 hearing aids was the real value of those. And they have Bluetooth and she loves them. So if you have a question, there's a telephone number here. It's called True Hearing. That's our provider for the hearing aids. Sounds pretty good to me. Okay, Medicare covered dental services. It says $35 copay, but guess what? There's very, very, very few Medicare covered dental services. So let's look at this, the $2,000 allowance every year for the non-covered. That would be comprehensive dental services. So everything but cosmetic stuff. Again, you've got this in the book right here. You can see the details. Here we go with vision services, $35, diabetic exam. There's no copay if you're diabetic to get an eye exam. Glaucoma screening, 0. Eyewear after cataracts, no copay for glasses after cataracts. Now, it is a limited selection of glasses that you can choose from. We understand that. And then you've got this, $100 off of glasses or contact lenses every year. If you find a provider that's out of the network, we have a form that you can use to still get that $100. Just call us and ask us for that form. We can send it to you. And then you've got mental health services, $395 for the first 4 days, like we talked about. Skilled nursing, if you go in rehab, no cost for the first 20 days. That's just like Medicare, no cost for 20 days. $196 a day for days 21 through 45. Medicare is $196 a day for days 21 through 100. And there's no max out of pocket. So if you just had Medicare alone, you'd pay $196 for all those 80 days. And if you ever are told that you need to leave a nursing home because your days are up, hey, if you feel like you're not ready, reach out to us. We can help you to appeal that decision. And because that happens sometimes. So physical therapy, $10 to $35 copay. Again, that's depending on the location. Ambulance, $300, like we said, 0 copay for 24 one-way trips or 12 round trips to the doctor, up to 150 miles. That's an increase for this year. Part B drugs like chemotherapy is 20% of the cost. Other Part B drugs, these are Part B. These are drugs not on Part D. D is in drug. Part B is administered in a doctor's office, 20% of the cost. So, and then of course you start to reach the $4,600 initial coverage limit. Then you get the donut hole. Again, call us if you have some questions about that. Then here's your pharmacy copays. Again, they like the mail order. We like the 0 copay on the 90-day supply through the mail order. And let's see what else we got here. Oh, watch this. Insulin. This is an insulin savings participating plan. So if you take insulin, you got $35 copay or $105 for 90-day supply all year long, all through the donut hole, no deductible. It's $35 if you take various types of insulin that fit in the criteria. Again, you have a detailed question about that, call us. Here's the extra help copays we talked about. And the coverage gap, that explains what a coverage gap, it goes all the way to $7,400, but part of that's what the discounted price that you don't have to pay. Again, call us if you want detailed explanation of that. Additional benefits, Medicare foot care, $35 copay, Medicare chiropractic, $20 visit for chiropractic, durable medical equipment like wheelchairs or oxygen, 20% of the cost. That's 20% of the approved amount cost, not the total bill. So again, I'm saying call us if you have questions, because there's a lot of, you have a specific detailed question about this, call us. Other medical supplies, they're basically 20% for durable medical equipment. Rehab, $10 to $35, cardiac rehab, pulmonary rehab, these are $10 visits. Telehealth services, again, 0 copay for a family doctor if you're just calling and talking to the doctor on your cell phone, or a specialist, $35 copay. Other things, we talked about the travel benefit. We talked about the 2 meals a day for 12 weeks, 168 total meals. If you have COPD, congestive heart failure, diabetes, or depression, you can get some of these meals, and you just call the number on the back of your card. They'll set it up and send you the meals. Acupuncture, 6 visits a year. Well done. That's the meal program after you come out of the hospital. The over-the-counter benefit, the 365 rewards. We have that we have 22. It's going to carry into 23, but you have to use your benefits by the December 31st. These are Go 365 incentives are when you go to the gym and use your silver sneakers, when you get your routine physical, when you get your flu shot, your coronavirus shot. Some people like those shots, some people don't. That's up to you. But you can get rewards and points, and then you can translate those into discount cards at different stores like Walmart. And then silver sneakers, of course, is there. So finding out more details you can find on the web. And of course, you're going to get this book. So then I just got to show you all the details. The multi-language, if you speak into these languages, we got you covered here for that. And scrolling to the end, there's a lot of blank pages, and that's it. So hopefully that makes sense. I know I covered that really fast, but I'm required to go over the summary of benefits book with you. If you have questions or details about any of that, definitely just reach out to us, call us, and we will be glad to help you. We appreciate your trust, your loyalty, and your business. You guys have a great day. Bye-bye.